Type 2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection.
Type 2 diabetes symptoms.
1. Frequent urination. The body attempts to eliminate excess glucose through urine. 2. Increased thirst. Similar to type 1, dehydration from frequent urination leads to increased thirst. 3. Increased hunger. The body's inability to properly use glucose can lead to feelings of hunger. 4. Fatigue. Inadequate glucose in cells results in tiredness and lack of energy. 5. Blurred vision. High blood sugar can cause the lens to swell, leading to vision issues. 6. Slow healing sores or frequent infections. High glucose levels can impair healing and immune response. 7. Areas of darkened skin. This condition, known as acanthosis nigricans, may appear in the armpits or neck and is a sign of insulin resistance. 8. Numbness or tingling in hands or feet. High blood sugar can cause nerve damage leading to neuropathy. 9. Itching and frequent infections of the skin, gums, or bladder. High sugar levels can promote yeast infections and other skin issues.
About 1 in 4 people with type 2 diabetes are unaware that they have the disease.
Diabetes can affect at least 8 organs in your body if it's not managed properly. Here's the rundown. 1. Heart increases risk of heart disease and stroke. 2. Kidneys can lead to kidney disease or even failure. 3. Liver can cause fatty liver disease. 4. Eyes. It causes diabetic retinopathy and vision loss. 5. Nerves. Neuropathy leading to pain, tingling, or numbness. 6. Blood vessels. Damaged vessels lead to poor circulation. 7. Skin increases risk of infections, dry skin, and other issues. 8. Teeth and gums. Higher risk of gum disease and infections.
Lifestyle changes include eating a healthy diet, regular exercise, losing weight, and not smoking. You may also need to check your blood sugar, cholesterol, and blood pressure to make sure they are within the target range to help reduce your risk of complications from type 2 diabetes. If lifestyle changes aren't controlling your blood sugar, your healthcare practitioner will prescribe medicines as necessary. Eating a healthy diet may help to lower your blood sugar level. You can help do this by eating a diet with fruits, vegetables, and whole grains. Have meals and snacks about the same time every day. Carbohydrates are substances your body uses to make energy. Ask your healthcare practitioner about meals with the right balance of carbohydrates, proteins, and fats for you. And reduce your intake of high-sugar foods. Getting regular exercise, even just 30 minutes a day, may lower your blood sugar level and may lead to weight loss. talk to your healthcare practitioner before starting an exercise program. Being overweight is an important risk factor for having type 2 diabetes. This is especially true if you have a lot of visceral fat. This is the fat you can't see that surrounds the organs inside your belly. The good news is that through diet and exercise, losing as little as 5 to 7% of your body weight can help significantly improve your blood sugar levels. You may need to take one or more oral or injectable diabetic medicines to help lower blood sugar. For example, metformin lowers the amount of sugar produced by your liver. It also makes your muscle tissue more sensitive to insulin. Sulfonylureas increase insulin release from your pancreas. Thiazolidinediones make your fat and muscle tissue more sensitive to insulin. They also reduce sugar production in your liver. Alpha-glucosidase inhibitors work in your small intestine to block the breakdown of starchy foods and slow the absorption of some sugars. This keeps your blood sugar from going up too fast after you eat. DPP-4 inhibitors let helpful chemicals in your digestive system stay active longer. These chemicals help lower your blood sugar level. GLP-1 receptor agonists increase insulin release from your pancreas when you're eating. They also slow digestion. And SGLT2 inhibitors increase the amount of sugar removed from your body in urine. If your diabetes cannot be controlled with diet, exercise, and other medicines, your healthcare practitioner may also consider insulin. Insulin that you inject helps to replace the insulin your body would normally produce. A healthcare practitioner will train you to inject it just under your skin.
Thank you. For more information, follow Doctorology by Sid.